To this day, I still see patients who are told there's nothing to do about Peyronie's disease, which is just not true. Hi guys, I'm Kristen Gumpf, a PA specializing in men's health. If you're enjoying the content, then like, comment, and subscribe to our channel. We're continuing our Straight Talk series on Peyronie's disease, and we'll be discussing how Peyronie's disease can present and how to find a specialist. The most obvious and bothersome symptom with Peyronie's tends to be curvature with erections. 1/3 of guys will have acute onset of curvature without having painful erections, whereas 2/3 will experience painful erections with or without curve. Curve can change while in the active phase, but it does not endlessly progress, which is a very common question from patients. So if you don't treat it, that doesn't mean it'll eventually do a full circle or anything. Curve can be present in different directions, most commonly a dorsal or upward curve when the scar tissue is on the top of the penis, but it could also be lateral, ventral, which is a downward curve, or a combination of these. Some patients can feel a lump or a bump in their penis, which is the scar tissue, and for other patients it may be less obvious. Most guys will also complain of loss of length because the scar tissue is within the tunica albuginea, which typically expands both in length and girth with erections and no longer responds the same way with Peyronie's disease. You can also experience wasting, which causes indentations or an hourglass shape to the erections, and typically more severe cases of wasting at the base of the penis can cause hinging with penetration due to limited axial support. Patients may also just present with a complaint of erectile dysfunction because their penis is different than it used to be. So getting an accurate history is important to know how much bother is caused by erectile dysfunction, Peyronie's disease, or the combination of both. If you have any of these symptoms, it's important to see a qualified provider, which can be found through the XIAFLEX website under Find a Urology Specialist based on your zip code. To this day, I still see patients who are told there's nothing to do about Peyronie's disease, which is just not true. So educate yourself, find a qualified provider, and discuss all available treatment options. On a future episode, we will discuss how to evaluate Peyronie's symptoms. So again, like, subscribe, and leave your comment below. See you next time.